name is Nicolette Gilbert. I'm a nurse practitioner. I just graduated from nurse practitioner school in last December. So I've been an RN for over 10 years. And I love being a nurse, but I love teaching nursing more, right? So I started doing tutoring since 2012 officially to get paid, but I've been tutoring since 2007 while I was in school. So it's something that I enjoyed. Actually, I didn't join the nursing program because I wanted to do bedside. I did it because my aunt was like, you need to eat. So I'm just being real and transparent. You're going to see my style. I'm very open and transparent about who I am and what I'm about. Anyway, so while in nursing school, I didn't really like it as much because my aunt was a nurse for many years and she was such a darn good nurse that she did over and beyond. And it kind of made her suffer a little bit because she was just too caring. So I thought, like, that's not the life for me. Anyway, so when I actually got into nursing school, I started doing well enough that I did really great. And my teacher was like, Nicolette, could you help these kids? And I'm like, okay. And then when I started to do it, I was like, oh my God, this is what I want to do for my life. Like I loved it. I love the theory. So what you're going to get from me is that passion and that understanding because I've given my life to that. Like I've always wanted to be a teacher, and then I became a nurse, and now I'm a nurse teacher. So it's great. Let's get to the actual topic of today, right? That we're going to the notes here. So these notes here, if you want the full length of the notes, you see like it has fluid and electrolytes, blood and disorders, neurological disorders, oncology, psych nursing, all of that stuff, right? If you want all of it so that you can kind of get ahead of your class, you can go ahead and purchase that and you have the nursing notes. Nursing is nursing, right? Every school has a different teacher that gives a different flavor to it, but it's the same context and the same content. You go to any state, any country, and you're still going to do nursing. In the same way, any nursing textbook will give you the same nursing information, but just spoken by a different person. So if you want the notes ahead of time, go ahead and go into here and on Thinkific. So then we have to assess the fluid and electrolytes. Right now, how do we lose it, right? Fluid deficit, lack of. So how are we going to know that this person is missing this fluid, right? How can we measure that, or why does it happen? So I kind of mentioned it already, right? I mentioned that you can have a fever, you can have vomiting, you can have diarrhea, you can have increased urine output, peeing a lot. We have what's called insipidus, diabetes insipidus, right? We've heard of diabetes mellitus, but that's the sugar diabetes. But the diabetes insipidus, which you will read about when we think about the adrenal gland disorders, that's when you peeing uncontrollably and you cannot stop. I remember, you guys, I'm always telling a story and it only helps, okay? I remember watching Grey's Anatomy. Is it Grey's Anatomy? No, House. I used to love House. And one of the episodes, this guy had this disease, and you know how they never know what the disease is in the beginning, and they're like, okay, he did this and he does that, and then he's coming and he's like, whatever, right? So one of the signs and symptoms that he has, he's like, I'm thirsty, I got a drink, I wanted some water. And the doctor's like, well, we don't know what's going on, so you're gonna be NPO, which means nothing by mouth. Well, Latin word for something else, but nothing by mouth. You can't drink anything. So then, because he got fed up with them, he locked himself in the bathroom, right? So that he could drink the water from the faucet. So then when they realized that he did that, they turned off the faucet, right? But this man was so thirsty that he started drinking from the toilet. And this is how bad diabetes insipidus can be. So yes, you can have so much urine, and the thing is, there's so much urine output, it's losing by the tons, by that this person is so dehydrated that they need water at all costs, and they will do whatever. So if you want to remember diabetes insipidus, remember House and the man that was drinking water in the toilet, okay? So yes, that is a reason for you to lose fluids and electrolytes. And remember, it's fluids and electrolytes. I don't know if you've heard it already, if you're already in school, right? But water follows salt. So anytime you lose water, you're going to lose the salts as well, right? And the little story behind that is when we look at the Olympians, right? Or people who are doing marathons and who are running, when they're running and they cramp, it's not really the lack of water exactly or only, but they're losing the calcium, they're losing, every kind of electrolytes in their body. And so when they have these pit stops along the way, they're not just giving them H2O, but they're giving them Gatorade that has electrolytes in it so that they can rejuvenate and replenish not only the fluids, but the water. So definitely there, right? Respiratory increases, right? We said there is water in our breath. You're breathing a lot, you're breathing fast, you're losing water. Medication used for diuretics, right? A person who has, let's say, hypertension, and you have to put them on diuretics, they're losing a lot more water than they usually would. You're gonna lose water. Poor IV replacement, draining wounds, right? With fistulas. So when you go into surgery, they're going to cut you open, and usually as they're cutting, they're spraying to kind of clear the area out, right? So that they can have access. And so that's a lot of fluid that's being placed into that area, right? I have someone here who's saying they also lose potassium. Definitely do, right? So we have this water that's being absorbed into the cells that has to be released. So once you get the drainage going, you're trying to pull all that fluid back out, but it can go too much, right? So you have third spacing. Let's talk about third spacing just a little bit, right? So third spacing is different from edema. Okay, because whereas edema is in the interstitial fluids, which we said was outside of the vessels, but and in between the cells, right, where the muscle and the tissue is, third spacing is in a cavity. And you know where your cavities are, right? That's like in the joints, bursars, or inside the like the let's say the space in between the pleural sacs, right? In between the heart and the rest of the body, where like what is it, what cardio, oh, I can't remember the words. We have the pleural sac, we have the pericardium sac, we have the peritoneal sac, right? We have all these cavities where these organs are sitting, and these little sacs, they have a little bit of fluid in them just to allow for movement so that the organ can expand smoothly and accommodate and do whatever it's doing, right? But when that fluid gets too much, now it hinders the action of that organ. Well, the third spacing is that's where the fluid is. And the difference between third spacing and edema is, with edema, the way to reduce it is by change of position. Like you kind of move away, and you, like if it's an arm, you elevate the arm. If it's a leg, you elevate the leg. If it's the right side, you put them on the left side. You shift in position, and that allows permeability, right, where the pores open up just a little bit and allows the fluid to seep right back into the position where it should be. Third spacing is not like that at all, because once the fluid gets in, it cannot come back out, right? And so we have to take it out manually. So in third spacing, like in the pleural cavity, for example, you're going to do what's called thoracentesis, which is when the patient is hunched over on like a table, and it's done in like their room. It doesn't have to be like a surgery. Hunch over the table, they get this huge syringe, stick it in their chest, and then aspirate the fluid. But the thing about that is you can't take but so much at a time. You can only take 1200 cc's at a time, right? So that is third spacing. Good to know, right? Burns happen third spacing as well because of the permeability, right? When you have a burn, like you have white blood cells, red blood cells, platelets, plasma, all of these things are coming to the site. And in order for them to come rapidly for healing, they can't come through the means of blood flow. They have to open the pores and get them there. And so that's where the third spacing comes in. Ascites is a person with liver disease where the stomach, right? We have the cavity, the peritoneal cavity, where all the fluid that has not been able to be filtered throughout the body, because the liver does like 102 things, and it's like eventually everything goes through the liver. So when it's shut down, it can't do its process. So a lot of fluid backs up into the system. What is it? The portal system, the hepatic system, whatever it is, and then it gets into the stomach. So like their stomach grows and grows and grows, and so it's called ascites. And these people, you have to measure their girth, right? That's a word that you're going to remember. That's important to remember. Okay, so then how do we assess this? We see that this is the problem. Like they have a fever, they have all these issues. Well, how do I know to assess it? Well, the first thing we have to wait. What are we going to find? There's going to be weight loss, right? They're losing water. poor skin turgor. Skin turgor is when I pull and then it remains up. So I'm very hydrated, y'all. Very hydrated, very hydrated. So then we have poor skin turgor, right? We have the urine's going to decrease. It's going to get darker, odorous, right? Because they might develop bacteria. Specific gravity. Specific gravity is when we think about the salts in the water, how heavy it is, right? So that's what that is. Increased respiration. We kind of talked about that. Dry mucous membranes, because you need hydration, you need fluids to moisten your membranes. Heart rate increase, about that, right? So the heart rate is connected to your respirations, right? And respiration is also connected to your fluids, right? So once the kidney realizes that there's a problem, the heart will realize there's a problem too, because the kidney pushes the fluid back to the heart, as you know, at whatever rate that it does, through the veins and the arteries and such. And when the heart realizes that there's not enough fluid, and the way it does that is like this. And when we see cardiology, we're gonna understand it better. But just briefly, so we know that the heart pumps through the largest artery of the body, which is the aorta, right? So the blood from the left ventricles goes to the right ventricles. Right ventricles to the left ventricles, and then ventricles to the aorta. So once the blood is going into the aorta, there are receptors. There are receptors that are the side of the aorta, right? That once that part of the heart expands, it senses the pressure, right? And then that goes back to the idea of blood pressure, right? When you thought about your vitals and the meanings behind what blood pressure is, it's like really phenomenal. You have to really understand that. But the blood pressure, the pressure that the fluid applies on that part of the heart, right, causes the heart to realize, I have enough water because I just felt that. Yeah, I got it, right? So, but if it doesn't do it, right, if it doesn't feel that tension, that stretch, it knows I don't have enough fluids. And so what it does is says, well, the body is small, but the body is dumb, right? So the heart won't know that it's because exactly that there's not enough fluid. It just thinks that, or maybe it does, I don't know. It doesn't have a brain, so I can't tell you what it thinks. But what happens is it says to itself, if it can, that there's not enough fluid coming out of me. So there's not going to be enough fluid going out to the main important parts of the body, including the brain. So what I must do is work faster, work harder. So if I can't push out as much output, I'm going to push faster so I can at least get it going as fast as I can so I can get the fluid out. So that's why the heart increases. Then we have hematocrit increase. So the idea behind that is this, right? So it's not necessarily, because hematocrit means blood, right? So is it that you have increased the amount of blood production? Not at all, right? What happens is the amount of fluid, the plasma that's in your blood is less than the actual blood cells. So when you are taking it and putting it in a centrifuge and you're spinning it around and you measure how much of each compartment or how much of each element of blood is there, you will see that there's more red blood cells than there are plasma. So it looks like there's more red blood cells, but it's not really that it produced more or created more, that the bone marrow, which is where blood is created, is producing more. It's just that there's more of a level, right? It's less water, so then it looks like it's more blood. And then we have decreased central venous pressure. Why? Because there's less water, right? And because there's fluid in our brain and in our spinal cord, well, when there's reduced fluid in our bloodstream, there's going to be reduced fluid everywhere, including the spinal cord. For more information on how to register for classes and get help from our tutoring center, visit www.gab-nicnursingtutor.com. That is www.gabnicnursingtutor.com. To view our free or paid classes, sign up on www.thinkific.com. That's www.thinkific.com and register for the pre-recorded classes of your choice after searching for the Gab-Nic Tutoring Center uploads. We offer in-person tutoring and Zoom calls. You can also find us on YouTube for more free classes and tips on how to do better in nursing. We are also on Facebook, where we upload articles, tips, and tricks on how you can make your journey to becoming a nurse smooth and near effortless. Did I mention Instagram? Basically, we are everywhere. So check us out or call 917-602-9927 and we will tell you just how to join. See you soon!